In the last section, we talked about the harmful effects of sexual contact with clients. Erotic contact is totally inappropriate and is an exploitation of the relationship by the counselor. Sexual contact with the client is unprofessional, unethical, and clinically harmful. Some of the consequences to counselors include lawsuits, being convicted of a felony, having your license, which you spent thousands of dollars and many hours obtaining, getting revoked, expulsion from your professional organization, losing your insurance coverage, and losing your job. When sexual intercourse begins, therapy ends. Sexual relationships are never the fault of the client. Once a client, always a client. Of the 559 clients in the study that became sexually involved with their counselors, 90% were adversely affected. The harm ranged from mistrust of the opposite sex to hospitalization. Clients are likely to feel confusion, guilt, and shame. Some clients exhibit a syndrome that's much like the rape and battered spouse syndrome. Years ago, a counselor friend of mine told me the story of a client that he had. She'd been in residential treatment for substance abuse and became sexually involved with her clinician. After she got out of treatment, he immediately, the clinician, moved the client in with him. She was later in therapy with my counselor friend because the relationship didn't work out, obviously. Her counselor/boyfriend had thrown her out of the house and she was suicidal. She was very vulnerable and this was very harmful to her. My counselor friend wanted to turn him in, obviously, to the board for his unethical behavior, but the client was very protective of him. She didn't want to cause him any pain or problems. She didn't want to get him in trouble. You can see how unhealthy and unethical this relationship was. Counselors who had engaged in sex with their clients had few arguments they could use in court. Not even consent or seduction by the client could be upheld. Clients are considered vulnerable. Sexual activity is a felony in many states, and often clients aren't even aware that sexual contact between counselors and clients is illegal. Non-erotic contact can sometimes be appropriate. However, counselors really are afraid of this for a lot of reasons. For one, it could be misinterpreted as sexual. They're afraid of their impulses or feelings towards clients. They may be afraid of intimacy. They may believe that to express closeness physically is inappropriate. Some counselors do not support touching because it can promote dependency, it can interfere with the transference relationship, it can be misread by clients, and it can be sexualized. However, there are other counselors that do support non-erotic contact. They say it can foster self-exploration. It can increase verbal interaction. It can increase the client's perception of the expertness of the counselor. And it can produce more positive attitudes towards the counseling process. Asking if you can have a hug or touch may be a safe way to deal with it. Again, make sure whose needs are being met. Touching should be spontaneous and an honest expression of the counselor's feelings. Sometimes, in the right situation, in the right circumstance, it can be stronger than words. Not being aware of or misunderstanding an ethical standard is not an adequate defense to a charge of unethical conduct. In other words, it's your responsibility to know what your code of ethics are, to know what standards you are upheld by, and to be very familiar with them. Professionals have an ethical obligation to deal with colleagues when they suspect unethical conduct. You can informally deal with the person, talk to them, let them know what your concerns are, what their plans are to make changes. If that doesn't work, then use more formal methods. Contact their supervisor or professional organization. If it's a really serious offense like sexual misconduct, you should probably go straight to the professional organization.